1st, maternity care during childbirth has been localized in Armenia. Minister of Health Derenik Dumanian's new initiative means that any woman is entitled to free perinatal care in the region in which she is registered. But if she chooses to give birth elsewhere, she has to pay 107,000 drams.
For example, pregnant women are referred from Syunik, Tavush, Gyumri and Shirak Mars if there is a need for it. We want this to happen in other places, but for other marzes to take responsibility. Only those who really need it should be referred to Yerevan. If it is not necessary, then they can quite easily give birth in maternity clinics in whichever region they live in.
According to the ministry, the majority of women who live in other regions come to the capital to give birth. The result has been that the number of births in regional hospitals has fallen. This hospital in Artashad, in Ararat Mars, has the same problems. The furniture is antiquated, but the doctors and midwives are very experienced.
This is the maternity ward. The mother is taken care of here prior to giving birth. The labour takes place in this room, that's the bed where they give birth, and this is the room for the child. Because we have been using these methods for the past 20 years, where the mother is in labour in the same room that she gives birth, and if the baby is born healthy and it doesn't need any special attention, then it is allowed to stay in the same room with its mother, and 2 hours later it is taken to another room. It is a big advantage as it wasn't like this in the Soviet times. We came to the conclusion that it is better for the mother and child to be in the same room. If everything is okay after giving birth, then we put the baby on the mother and we try to feed it in the first half an hour if we don't have any other counterindications. At one point, the maternity ward had 1,500 to 2,000 births, most recently 1,200. These were the numbers up until 2006-2007, after which the numbers slowly started decreasing. It's probably to do with the decrease in population in the country due to migration. But a significant factor is that we don't have luxurious rooms, the necessary furniture and equipment. So many women would rather go to give birth somewhere with better conditions, without knowing who the doctor on duty is and how they will assist with the birth. And they go there not knowing anything, just because it is Yerevan.
In 2008, a certificate for support during childbirth was introduced, after which the flow of expectant mothers into Yerevan began. Many people think that a result of this has been a decline in maternal deaths. UN Population Fund representative Gari Kairapetyan says that if the ministry has equipped the regional clinics, then the population needs to be informed.
There are solid grounds for our concerns. In reality, the hospitals in the regions weren't prepared even for the most normal birth, because if something was to go wrong, they didn't have the resources. For example, blood donors. And by the time they brought resources from Yerevan, or they took the patient to Yerevan, it was often too late. In all cases, these problems exist and it was necessary to inform the population of these changes. I think this has been the greatest flaw.
To reduce the risks, it is advised that any woman who is to have a difficult birth should immediately be referred to Yerevan by their regional doctors.
If God forbid there is a real reason for the patient to be sent to Yerevan, but the doctor doesn't refer them to Yerevan so that they keep the money, then if anything happens, it will be the doctor's responsibility. Is the money the doctor receives for caring for the patient worth more than the risk which the doctor takes responsibility for? This needs to be taken into consideration. And if we think that if all the normal births and healthy children were taken care of in their own regions, then it would be completely pointless to not refer a rare case of a difficult pregnancy to Yerevan.
According to the ministry, in the past month, there has been a 10% drop in the amount of children born in Yerevan. Doctors in regional hospitals have said that the number could fall even lower if conditions in local hospitals are improved.